This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy! All right. We are back. This is the Berman Method podcast where we specialize in treating problems and not symptoms. I'm Jenny Berman, physician assistant, and I am solo today. No Jake today, but he will be back next week. Don't worry. So I am just going to dive on in. I hope everybody's having a great week. Happy hump day. And fun plans this weekend. I know it's still a couple days away, but maybe you're thinking about that already and really just enjoying every day as we go through. I am going to jump straight into our topic of the day, which is going to be supplements. We get a lot of questions about what supplements should I be taking? Should I be using any supplements? And although this is very, very personalized, we can start to talk about some of the ones that we do carry in our office. Now, this isn't everything we carry in our office, and it's not something where I'm recommending all of these supplements to every person. It has to be very individualized, but we will talk about a couple of them specifically. So to start off, I just want to say I don't recommend anybody taking any extra supplements without speaking to their medical provider first. As we know, some supplements can actually interfere with certain medications. So this is really important that you're very careful. This is simply informative, not directing anyone to use supplements and not treating anyone, as we don't know what medications you are taking unless you are actually one of our clients. So when we do supplement recommendations for our personal clients, we actually will do an initial consultation, go over their medical history in depth. We will do lab work so we can look at different values, and then we're able to identify based on their medical history what lab work comes back and their goals, what supplements are going to be the best for them specifically. And then we're able to come up with a very detailed letter explaining their blood tests and their goals and why the supplements that we're recommending are helpful. So again, just kind of going over, reiterating, this podcast is simply informative just to get you thinking, but you should definitely reach out to us or reach out to your medical provider about starting or changing any supplements. So first things first is a multivitamin. Most people will think they need to be on a multivitamin, or they will go to Walgreens and just pick one up, which is great. We should, majority of us should be taking a multivitamin, as they do provide a lot of vital nutrients. Most of them will have vitamin D. Some of them will have a magnesium type in it. Some will contain alpha lipoic acid, which is really important for the metabolism and blood sugar stability. Of course, some of the other vitamins that'll be in there, C, B12. We have to be careful, as some multivitamins actually contain vitamin K or iron, which could be not so good for people who are taking blood thinners or have a history of blood clotting, stroke, heart attack, things like that. So we do need to be aware of that. But in general, multivitamins are usually beneficial just to at least get the bare minimum of the vitamins and minerals we should be getting every day. We use a multivitamin that actually has 2,000 IUs of D. So again, important to know that, because if you're already taking D and then you start our multivitamin, you may be getting too much vitamin D, depending on the person. But it also does contain that alpha lipoic acid, which we know is very helpful for blood sugar stability and for the metabolism. It also contains higher levels of B12 than most vitamins, has some vitamin C in it. So it's in general, a very great and well-absorbed multivitamin. So moving on to something called CoQ10. A lot of people have heard of CoQ10 to help with maybe counteracting symptoms of statin medications, but also helpful with the cholesterol. We actually will recommend using a supplement called ubiquinol, which is a more bioavailable form of CoQ10. It's an active form of coenzyme Q10. So that can also be a little bit more helpful to improving the cholesterol, lowering cardiovascular inflammation, just because it's in a form that the body can absorb it a little bit easier. It does not have to be converted. Fish oil, lots of people ask about fish oil, but then they say, oh, I hate taking it because of the repeat. So, there are fish oil supplements out there, like the one that we carry, that does not repeat on you, which is super nice because when that happens, it is just awful. If you've experienced that, you definitely will know. But fish oil also is really helpful for cholesterol. It helps with reducing the bad cholesterol, which is your LDL, but can also help with promoting the good cholesterol or the HDL. The other thing about fish oil is it actually can help with promoting good bacteria in the gut lining. So that's really important. You do want to be careful on the type of fish oil, so there's the omega-3, 6, and 9. Some of those omegas are better than others. So you want to make sure that the fish oil you're taking actually has a good balance between the omega-3, 6, and 9. This is like, some fish are great omegas, but they just have too much of the bad omega, which could increase our saturated fats and our cholesterol, whereas the better omegas are going to have more unsaturated fat, monounsaturated fat, which is a good fat, and that actually can help with promoting the good cholesterol. So we need to have a good balance of our good fats and bad fats and make sure that our body is utilizing the fat stores appropriately. All right, continuing to dive on into supplements, we have things like vitamin D, B12, magnesium, vitamin C. We hear a lot about these supplements, and you can easily buy vitamin D over the counter. You can buy magnesium, although I'll talk a little bit more about that. And then B complex or B12. So B complex will actually contain all of the B vitamins, including usually a little bit of biotin, versus B12 is simply B12. B12 is important for metabolism. It's important for energy. If you are taking a medication to help with reflux or what they call a PPI, those can actually deplete our B12 and magnesium stores because we don't absorb those vitamins as efficiently with those types of medications. So instead of taking a B complex, you may benefit more from a B12 vitamin, which again will help with energy levels. It'll help with the metabolism itself. Magnesium is really important for our bowel movements. So to prevent constipation, it's important to prevent muscle cramps. It actually helps with calming us at night to go to sleep. So that's, all important as far as magnesium. It's very calming, but a lot of times over the counter, we'll find magnesium oxide or magnesium citrate. Magnesium oxide is not greatly absorbed by the body, so it doesn't do us a whole lot of good unless your cardiologist has recommended it. Magnesium oxide is important for the heart, so if that's the form your cardiologist recommended, definitely stay on it. Magnesium citrate is very, very potent and can actually cause loose stool. It can actually break down the gut lining because it's so potent. So I don't usually recommend magnesium citrate unless it's absolutely needed for the bowels if somebody's feeling very constipated, but I would recommend only taking it for a couple weeks at a time. Different forms of magnesium, magnesium glycinate and magnesium taurate are very well absorbed forms of magnesium. They are not so harsh on the intestinal lining, so it can be something that we utilize consistently in the evening times to help us with that magnesium replacement, muscle cramps, sleep, relaxing, and to help with keeping the bowel movements consistent. Vitamin D is a fat-soluble vitamin, so this level can get too high into a toxic level. And again, this is something that through the virus, it has been pushed and pushed and pushed. But the things people don't talk about is that the level should be monitored because you can get to a too high of a level. Now, vitamin D deficiency is very common because it actually is part of insulin resistance, which again, we know is very common. And if you have insulin resistance, it can cause a low vitamin D level. If you're overweight, it can cause a low vitamin D level because the vitamin D actually gets absorbed into the adipose tissue or fat as opposed to where it should be going in the bloodstream and in the bones. But on the other side of that is when we take vitamin D supplements, sometimes we're absorbing way too much of it. So we need to be very careful. Some other things, vitamin C, I did mention that. So obviously helpful for the immune system. Too much vitamin C, however, can cause loose stool. So that's something to be aware of if you're taking too much of it, being mindful of that. Now, some other things as far as gut healing supplements, which can be very, very beneficial, not only to help with the bowel symptoms themselves, but also with reducing inflammation, helping digestion, decreasing that antibody level that rises with food sensitivities that we've talked about in the previous weeks. Glutamine is a supplement that is used for muscle recovery. So people who do work out or bodybuilders will take it, even if you're not a bodybuilder, but exercising consistently, glutamine can be very helpful for muscle recovery. But with that also helps with recovering of the gut lining. So people with known food sensitivities or leaky gut syndrome could be really helpful. Occasionally digestive enzymes can be helpful as this will increase the amylase and lipase to actually help us with breaking down food particles and reducing inflammation. Probiotics, very touchy subject. Some people really would benefit from taking a probiotic and helping to balance that good and bad bacteria within the gut lining. Some people cannot tolerate probiotics because they have such a leaky gut. We're not actually absorbing them properly and can actually stimulate more GI issues. So again, very specific person-to-person basis. We oftentimes will start our gut healing process and going through healing before recommending starting a probiotic, but then potentially at some point, our client may start it to help with keeping that balance. So really important that you find the right type of probiotic, a live versus not live probiotic for some people, one that's dosed once a day versus multiple times a day for specific people. That is very patient specific. Let's see. We oftentimes will use Berberine, which is a plant sterol to help with glucose metabolism or lowering blood sugar stores, which will help with increasing the metabolism and burning fat. So that is a supplement that we often use with insulin resistance, although again, have to be very careful with medication interactions. So definitely ask your provider. NAC is something in acetylcysteine is a supplement that has been more well known through the virus as well. It does help with reducing inflammation naturally. So it's a natural anti-inflammatory, but not an NSAID, which a lot of people aren't able to take. Speaking of natural anti-inflammatories, we do use a supplement in our practice for people with autoimmune disease, specifically Hashimotos, that can help with reducing antibody levels and decreasing inflammation as well. This does have a pineapple extract in it, though, so we have to be careful with people with a pineapple sensitivity. And yes, that is a thing. So, there's a lot of different types of things that can be helpful for different people. I have just run through a ton of information, and that doesn't even touch on everything that we utilize in our practice, just some of the more common things that people will find over the counter and just say, "Ooh, I think I should take this. It sounds good," or "I saw it on TV. I'm going to take this. It's great." But then later find out that it's interacting with their blood pressure medication or with their blood thinner. So we have to really be careful about that. We do use some supplements in our office to help with sleep. I am hardcore against prescription medications for sleep, especially things like Ambien or Zolpidem. But there are some very, very beneficial aids to help with sleep if we've looked at things like your cortisol level, your magnesium level, your blood sugar stability. If we've corrected all these other issues that can cause the interruption of sleep and we're still struggling, there is a supplement that we'll use that has a combination of some herbs and L-Theanine, and it actually contains magnesium, but also a little bit of melatonin to help with sleep. And that's been really helpful. The reason being is melatonin sometimes will help people get to sleep, but won't keep them asleep, which is a big issue. So again, we go back to, is it because of a blood sugar instability? Is it because of a cortisol level? And if those things are normal, then, sometimes we find that we just need help with maintaining the enzyme levels to keep you asleep. And that's where either a prolonged release melatonin is helpful, or potentially that melatonin in combination with the L-Theanine, which is a stress reducing or cortisol lowering amino acid, could be helpful. So again, depending on the person and the cause of the sleep disruption, depending on the stress in their life, these things can be helpful. That brings me to L-Theanine, very, very, very helpful amino acid to reduce the stress response. So if you are chronically stressed or have a lot going on in your life, adrenal fatigue is another diagnosis. L-Theanine is this natural amino acid that can really help with reducing the stress response in the brain, and also talking to our adrenal glands that release cortisol, or a stress hormone, to help with keeping that more stabilized, improving sleep, improving overall anxiety, depression, or stress feeling during the day. So that is a big one that's very, very helpful. Let's see, methylfolate, if anyone has heard of that, it's actually one of the supplements that I'll commonly recommend in infertility to help with keeping the folate levels up, which we know is very important for folic acid to the baby. So methylfolate can actually be helpful in the whole endometrial lining and keeping the hormones balanced and the baby healthy when we are trying to conceive or when we are pregnant. So that's another one. We'll check the labs, but we may recommend. Oh my goodness, this has been a lot of information. And again, we haven't even talked about every single thing we use. But if you have a specific question about any of the supplements, how it may be helpful for you, what supplements you're taking, if it's a good one, if it's even necessary, because again, we find a lot of things on the internet that we'll just start taking and we may not even need it. I do recommend that you are careful with what types of supplements you use, as not all supplements have been researched. There's not a lot of data on a lot of supplements. Obviously, supplements are not FDA approved. The Food Drug Administration doesn't do studies on supplements, but the individual manufacturers and producers of these supplements can do their own studies and research. So that's really important to see if they've been tested and tried and what the data is showing there. We use Pure Encapsulations in our office, which is a hypoallergenic supplement company, and they do their own studies. And in fact, if one of the supplements fails the trial or the study, it cannot leave the manufacturer. So sometimes we'll find that some of our supplements are on back order just because one of the lots didn't pass the test, and so they got backed up a little bit. So it is really important to make sure that there is a good quality measure behind the supplements that you're taking, reaching out again to a provider and finding out what the best supplement for you is going to be. I do not recommend just going to the store and buying things off the counter and saying, hey, this looks great today, I'm going to take it. So just, again, being very careful with that. But can supplements be helpful in helping with weight maintenance, with gut health, with brain fog, with energy levels, with sleep? Absolutely. So just making sure that it is the right thing for you based on your medical history, your goals, and your blood test. All right. So I know we talked a lot about gut health this last month and now supplements and how that can be helpful. We're going to continue to dive on into helping you guys take that next step to your overall wellness, helping you with reaching your goal weight, improving your energy level, and just adding years to your life. I mean, this is all really important to keep you going and add that extra day, enjoy the extra day. So Jake will be back next week. I'm trying to remember what we're going to be diving into next week. I don't even know, but we're excited. So stay tuned. And you can always reach out to us. I know we say it every time, but reach out to us on our social media, reach out to us through our website, email us, call us. We are happy to help you guys. Thank you for listening and supporting us. I can't believe we're already towards the end of January, beginning of February. Oh my goodness, this is wild. All right. Well, I hope you guys have a great rest of your week. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.